Welcome back to Cog Extra. What's next for the National Health Service? I'm Dr. Jack Kreindler, here again, founder of and medical director of the Centre for Health and Human Performance in London, and delighted to be welcoming you from wherever you are in the world, or welcoming you back from previous sessions. Please don't forget that you can send questions for the speakers on this session on the CogX platform. Also check out the expo and drop a line to some of the organizations that are showcasing their innovations here. So onto the session. COVID-19 clearly has changed the way in which we view health, and not least the power of IoT. Wearables and medical devices. The question we have to ask ourselves now is, how do we create a healthier society by empowering people with wearables and data? How can we monitor and prevent folk who have been ill, who will become ill? And most importantly, can we do this ethically and implement these devices in a way that preserves privacy, as well as giving us deeper insight into ourselves? And sharing this panel, I'm very pleased to introduce Benedict Cooney, who's the head of science and innovation and all external comms for the esteemed Tony Blair Institute for Global Change. So welcome, Benedict.
Hi, thanks, Jack. Hi, everyone. Welcome to this session on preventative health and wearables. I mean, Jack's just given a really great introduction, but yeah, I'm the head of science and innovation at Tony Blair Institute. And, you know, well, personally, I suppose I got involved with sort of the wearables just through, you know, as any sort of other consumer, buying Fitbit, Apple Watch, you know, and sort of being someone interested in fitness. It was probably a behavioral thing to sort of look at, you know, just the basic statistics on how much I've done on my run and such. But I think, you know, as I sort of, after a few years of having it, I, you know, could begin to see sort of variations, you know, whether I've had too much alcohol affecting my sleep, or, you know, whether sort of my, you know, resting heart rate had gone up and I hadn't been doing enough exercise. And so then this intuition about sort of the potential for them was then really underlined at the beginning of this pandemic, when some of the work of some of the panelists we got on today was in looking for how you could basically detect COVID as an early warning system via wearables. And so the objective of the session is therefore to highlight the potential that wearables can have in fighting the pandemic, but as well as the longer term role within healthcare. You know, maybe it'll help persuade you to buy one, or even better, you know, thinking of the role of the state of this, for the state to begin to think about the provision of these, such as Singapore has already. So without further ado, I have here with me today Jennifer Rayden, PhD, who is an epidemiologist and a senior staff scientist at Scripps Research Translational Institute, and has been leading their study on the use of wearables to detect viral illnesses, including flu and COVID. I also have Professor Snyder, who runs the Stanford Healthcare Innovation Lab, and he's the author of Genomics and Personalized Medicine. This was released in 2016 and actually has a chapter on wearables, which at the time people were telling him he was crazy to be writing about this. But he's also now today running a study on use of wearables to detect viral illness as well. And then last we have Ahmed, who's the founder of a number of health organisations, including Selfless, and is also currently leading the work at the NHS England on the impact of COVID-19 on BAME staff. So welcome all to the session. And that is the very abridged versions of all of their biographies. You know, we'll be here for the rest of the session, really, if I walk through all of their accomplishments and achievements. But we were just, you know, just prior to the session, we were just discussing our first wearables. But perhaps, you know, just as a starter to kick things off, you know, the question for you guys is actually, how many wearables do each of you own? I know that Michael might set the record on this, but
well, do you want me to go first? I use about 8 of these devices every day. I have, in fact, 4 smartwatches right now that I'm wearing. I usually wear a ring, but I actually lost that the other day when it slipped off while walking the dog. But yeah, I'm a big believer in the technology.
I usually wear 1 at a time. I do own 3. Well, I'm certainly the loser here, because I've got an Apple Watch, but being a good clinician, bare below the elbows, so unfortunately I don't have it on now.
Great. Well, yeah, I don't think any of us are going to match Mike, who really sort of lives what he preaches.
Yep.
Yeah. That's it. But just to sort of kick things off, Jennifer, I'd love to just sort of dive in a bit to the study that Scripps have been working on, the DETECT study, which, I mean, they published some of the findings in January earlier this year, looking at the detection of influenza, and then you've published further papers in Nature later this year looking at COVID-19. Could you just give a bit more information on this and what it's trying to achieve?
Yeah, so in January, we published a paper that was looking at whether we could predict influenza-like illness among populations using Fitbit data. So we had access to a retrospective Fitbit data set of 200,000 users in the US who wore their device for about 2 years. And so, as you all probably know, every person has a really unique resting heart rate and unique sleep pattern. And if you compare each individual to themselves over time, you can identify weeks where their data is different from their average or norm. So we looked at weeks where individuals had an elevated resting heart rate and sleep that was higher than their norm. And we found that this, the proportion of users each week was significantly improved predictions for flu-like illness. And this actually really inspired our now DETECT study, which is prospective, where we have participants can join our research study through an app called My Data Helps, and they can share their wearable data and also report self-reported symptoms, diagnostic test results related to COVID or flu, and connect to electronic health records. So we're hoping to kind of recreate the findings that we did previously with flu-like illness to see if we can track both individual changes in a user's wearable data that may indicate that they're coming down with a COVID-like illness or a flu-like illness, and also population level changes, looking at the aggregate to see if we can identify trends in COVID or flu-like rates in a population. So it really has the potential to speed up our ability to track viral illness activity faster than kind of traditional surveillance means, which are often delayed by 1 to 3 weeks. So it's wearables really have the ability to get a real-time picture, both the individual and population level, which is very exciting to speed up response efforts.
Yeah, the real-time continuous aspect of this and the ability to, I think one of the lessons that we've seen throughout this sort of pandemic has been, I guess, the failings of traditional surveillance systems. And I think, the deployment of wearables potentially offers up the big opportunity for this. And I think, Mike, you've discussed this as well previously, haven't you? I mean, you personally diagnosed yourself with Lyme disease, I believe,
That's right, yeah.
a few years ago, sort of having seen some of these markers. So maybe you can sort of talk a bit about your study as well, and sort of how you see that sort of broader role in surveillance and some of the sort of, I guess, the failings of the old mechanisms.
Yeah. Okay. Well, as Jennifer said, I mean, these technologies are amazing because they let you follow yourself in real time, 24/7, 7 days a week, 365 days a year. So you can really follow your physiology continuously. And so we got into this because we were studying, actually me and a group of other people, with these devices and other sort of advanced technologies. And what we discovered was that, in fact, the way I got into this is that I figured out my Lyme disease, of all things, from a smartwatch and a simple, what's called pulse ox, that measures your blood oxygen. And so the way this happened was I discovered that my blood oxygen was abnormally low and my heart rate was running very high. And then I later learned my skin temperature was elevated as well. And so it turns out that, it went up, it was Lyme disease. I went to a doctor after that, and he pulled blood and said, yep, you got a bacterial infection. He actually recommended penicillin, and I told him I needed doxycycline, which is what you use for Lyme disease. But then we went back like Jennifer did. We had a lot of data, so we went back and looked at it, and I'd been ill 4 times, and every single time I was ill, I had this elevated heart rate. So we realized that you can actually tell when you're ill. One time I was even asymptomatic, which is kind of a big deal if you think about the COVID pandemic running now. So every time I was ill, including the asymptomatic time, we could pick this up with a smartwatch. And so we wrote an algorithm, the first version called Change of Heart, that tells you when you're getting sick because your resting heart rate jumps up over its normal background. And so it turns out for a regular illness, say a flu, a common cold, it'll jump up typically about 2 days, 30 hours earlier than when you're symptomatic. And as Jennifer's done, we've rolled out a study as well, where we've actually shown that you can see this with COVID-19. It works about 85% of the time. People will have an elevated heart rate. It does miss some cases that are probably complicated. And now we've set up a real online detection system, meaning we're following people in real time, and we're about to scale this for millions of people, where we can follow millions of people real time. And when we see an elevated heart rate, we ping them and let them know something's up. And many of the times it'll be some sort of respiratory viral illness, but some of the times it may be other things that trigger this as well. But nonetheless, it's an alarming system that we think can alert people to the earliest signs of when they're getting ill, certainly well in advance of when they're actually feeling symptoms. And for COVID-19, we would say we can see an elevation in heart rate on average about 4 days before symptoms appear. And for some people, it's as much as 10 days. So people will be running around for 10 days, spreading the virus, presumably, without knowing it. And with the smartwatch, we think we can catch that early.
Super. I mean, I guess the sort of the power of this also then lies in how it sort of integrates with the sort of the clinical system more broadly as well. You're not going to get a diagnosis via your wearable with your heart rate. So you need sort of the system to be, whether it's sort of your telemedicine and then your sort of diagnosis happening via your doctor. I just wonder if maybe Jennifer and Mike, you can sort of both have a little sort of discussion on how you see that points on how the system then works, and then Naeem, you could add in how you sort of see this from sort of the clinical perspective and some of the elements that you'd be thinking about bringing that in as from the sort of the clinician's perspective.
Yeah, well, currently we screen people by taking mostly temperatures and asking for symptoms that they may be experiencing currently. But those, as Mike said, usually occur many days into your illness. So they may miss that kind of pre-symptomatic phase. And also only 30 to 40% of people who have COVID and present to a hospital actually have a fever. So it's a really bad screening tool. So wearables really have the ability to potentially catch illness earlier and also be a kind of an early warning signal that maybe you should stay home and get tested until you really know what kind of viral illness you have.
Yeah, and the way our system works, we set it up as a 2-alarm system. So first you get a yellow alert that tells you something's going up. And if it keeps going up in the next 12 hours, it means something's not right. And certainly even with that first system, you might want to just, stay at home, don't go out to a bar and spread this or what's around. If it goes back to green, everything's fine. But if it goes back to what we call red alert, well, maybe you want to self-isolate, possibly even see a doctor. You will need a more traditional test to know if you've got COVID or something else. So it's really meant to aid that something's going on, that there's an alert. And as Jennifer said, we're very traditionally, our medical system's really working around this idea of temperature and fever. And particularly in the case of COVID-19, that may be absolutely the worst thing to be following. Maybe not the worst thing, but certainly not the best thing to be following to tell if someone's ill. So we think other measurements are going to be much, much more powerful for telling you when you're getting ill. And also, you're not going to wear a thermometer in your mouth all the time. You're going to, have to use something else if you want to follow you in real time all the time.
I think, Mike, you make some really great points in terms of as a frontline person that's working in the National Health Service. I'm excited by the opportunity that wearables bring, particularly bringing into focus with the current COVID-19 pandemic. having an early warning system in place, which will allow us, particularly with the healthcare workforce, being able to identify those that are at risk or unwell, would be of immense benefit right now, but both in preserving our healthcare workforce, but also in enabling us to start planning and delivering our care better. I think the worries that I have really about the whole movement and the idea around wearable technology is that will it exacerbate inequalities, or will it bring something in terms of kind of reducing inequalities? And what we've learned more than ever now with the COVID-19 pandemic is that actually it is a virus that discriminates, and community groups have been impacted differently by the virus. And I think that there is a very real possibility that technology might add to that, given just on the simple terms, the pricing points around wearable technologies. So in short, I think the clinical application of wearables is exciting, but I think we just need to think about the kind of medium to longer term implications of this in terms of how we are approaching care. But Mike, as you said, moving to a proactive kind of state of mind and approach to medicine versus reactive is certainly the way forward.
Yeah, if I could respond to that, I think actually the beauty of wearables to me is that they can reach everyone on the planet potentially. If you think about it, 60% of the world has a smartphone. So all you have to do is pair that with a simple smartwatch, and even just something as simple as resting heart rate can help detect disease at a very, very early time. So I really think that in these devices, I think they're going to be $20 US in the future. So I think in the long run, you can have a simple device that's measuring at least some level of your health all the time and can reach most of the planet, which is pretty incredible. Now, I know right now there is some inequities and things, but I would argue the inequities are worse given the existing system with PCR testing, the way we handle COVID now. So the beauty of wearables is they're much, much cheaper, and they can reach more people, and they can reach them all the time. So I'm a believer, maybe I'm just very Pollyanna, but I really think this stuff can actually hit the whole world. And there are people like, Tony Blair's Institute that really want to make that happen. So I honestly think we can do it.
Mike, on that point, really, as a personal example, so the organization which I helped found is Selfless, and one of the programs that we were delivering was using smartphones, well, just your normal mobile phone, and providing voice notes to mothers in rural areas around pregnancy. So what we knew is that actually these mothers were finding it very difficult to access your maternal care in rural villages in Bangladesh, but they all had a mobile phone of various levels of complexity. But if we could provide health messages to them on their mobile phones, so we knew that there was a problem with literacy, so we looked at voice notes and so that they could understand what was happening with their pregnancy, and I think that was a really basic way of, I guess, wearable technology, but provided penetration of those health messages in very, very challenging circumstances. So I don't want to be completely negative about it, but there is a potential, but we need to bear in mind the costs and accessibility.
Yeah, I mean, I guess the question here, I mean, it's sort of a twofold one, really, then, which is, I mean, even sort of in the research, I mean, 8 million people in the UK already have wearables, but I guess that would skew more towards people of higher socioeconomic status, probably younger people who tend to be fitter as well. And then sort of in America, I know the figures are 20% of the population, if I'm correct, have it. So you're actually getting a huge amount of data in, but it needs to be sort of diverse. But then there's sort of the second order question, which is just the access, and then I guess your education side of how you can sort of, I mean, people can become quite empowered, I think, by just sort of understanding their own health and their own sort of metrics and sort of the variations within their healthcare. But I guess it just sort of needs to, again, sort of back to the broader question about how, I guess, we deploy these and how we sort of work in sync with clinicians and healthcare providers to ensure that these become, quite powerful autonomous devices, but at the same time are then really sort of enabling much better healthcare delivery. Yeah, maybe Naeem, you want to?
Yeah, I mean, one of the key issue, I mean, it's the overall issues around trust and both trust in technology, which is a broader conversation that I hope we can touch on. But in terms of a patient-doctor relationship, when there are so many different forms of wearable technology out there, there's different forms of apps that can be downloaded. What we really need to get to, I think, is which I hope won't stifle innovation, would be some sort of kite mark in terms of this is something that is trusted and the general public can consume, and medical professionals say that this is something they can use. And I think then the next step would be looking at whether you go to a doctor and you're able to be prescribed a wearable, and that seems to be a normal part of any preventative health treatment that people are on. So, for example, in diabetes care, I could certainly see wearable technology playing a very key part of that. But the issue is, with so many products on the market, how do we make this idea of trust be central to it all?
Jennifer, just take a step back onto some of the I mean, because epidemiology has been sort of thrust into the limelight throughout COVID-19, and I think probably been a sort of an underpriced risk historically. I think we can sort of say potentially with hindsight. But just sort of, do you think you can get towards any kind of real surveillance, of viral illnesses and COVID without wearables?
Certainly, other groups have tried. There's Flu Near You. People track Twitter and Google searches. So there's many other methods of kind of getting a feel for kind of real time what's happening. However, wearables are really kind of the only objective way to kind of track viral illness. Google and Twitter are often influenced by the worried well, or people just searching for what's going on in their area, but may not themselves be sick. So I think there's a huge potential to use these wearables. It gives us a good denominator on who's well and who's not well. Whereas Flu Near You, people only kind of report if they're actually feeling sick. So I think, again, there's real excitement due to the objective nature of these tracking devices.
And if you were to sort of speak to the CDC today, or to the UK sort of survey, they're trying to sort of, again, there's been so many problems, even just with sort of like testing regimes and surveillance, even on a localized level. Like, what would your sort of recommendation to your sort of your state level epidemiology and sort of surveillance systems be within wearables?
Yeah, well, at least in the US and many countries, flu surveillance and viral illness surveillance is delayed by several weeks, and the numbers that are reported are often even revised weeks and weeks later. So I think wearables have a real potential to kind of complement these traditional data streams, and also be able to, since 1 in 5 Americans wears these, we can potentially zoom in and look at more local areas and better understand kind of where the hotspots are. Whereas kind of traditionally, surveillance is done at a much larger scale, and you don't know where in, say, California that an outbreak may be happening. And so, yeah, I think there's great potential with these devices.
Yeah, and if I could add to that, I think if you wait for symptoms, you're already 4 days behind on average. Yep. Again, if people are just logging their symptoms, it's 4 days on average after they were first getting ill that's detectable. So the bottom line is, if we do it with the wearables, we can get a much earlier head start.
Yeah, and I'll also add, even with the growing number of tests available in the US and other countries, we're not going to have enough tests to routinely screen people. So really, wearables since we're continuously wearing these, we can kind of identify where kind of blips are occurring in your data, and then maybe you should get tested, so we can kind of better handle our testing resources.
Yeah. And what are the sort of the big policy questions that, is this sort of tension between, that people sort of deny that sort of it's a tension, sorry, so I've said it a different way, which is like, obviously the economic impact is incredibly large if you go into lockdown, and there are some tools at our disposal which are actually, and Mike, you sort of touched on this earlier, which could be far cheaper and effective in the longer term. And your sort of vision for sort of wearables, and we talked about this previously as well, which is like, these things now cost $100 for a Fitbit, but they could be $20, within not too distant future. And so how do you see that sort of playing out? And how do you think that there should be just an increased access, via government potentially? Even I say Singapore has already done it, but could you see a sort of a big role for state deploying these resources and giving them particularly maybe to vulnerable groups to start with, and maybe then scaling up?
Absolutely, yeah. So it'd be great to see organizations like yours and others step in and deliver these. I could also see any provider, when you sign up, become part of a new plan, you get one of these. I could also see every employer wanting to put one of these, or at least voluntarily in the case of US, on their employees so that they actually check maybe their resting heart rate before they go to work that day. That's going to be much, much better than flashing a temperature on somebody's forehead right when they show up at work. And then you say, well, no, I ran here and that's why I'm hot, and so let me in anyway. But you could actually just look at what their resting heart rate's been for the last several days and have a pretty good idea of what their health state looks like. So I can see there's a vested interest in all these groups, your employer, your health provider, and I would hope, charitable organizations to reach out to as many people as possible and offer this. As I say, it's very, very inexpensive compared to the actual downstream health costs. When somebody gets ill, that's incredibly expensive, especially in a pandemic like this. It's hugely expensive. So it's got to be economically cheaper. I haven't done the modeling, I'm sure others have, to put a $100 device on everyone on the planet than try and treat them afterwards when they're all in the hospital, or many of them are in the hospital.
I agree, but I think that prior to that, there needs to be a sustained engagement process to build up trust within workforces and the general population that this is not surveillance. This is a tool to help keep you well. And I think if that message cuts through, then you'll have a greater chance of success.
Yeah, 100% agree. And so we have to get the health system to embrace this. They like this, but they're conservative by nature, so they tend to, be skeptics, I would argue, and justifiably so. But so we have to demonstrate utility. Then I hope it does get embraced. But I think around the privacy issue, it's strange to me that everybody's happy with credit cards, and that's got a ton of personal information. That's all over the place. My credit card company knows where I am at all times because when I use it. Yeah, everybody's scared of their health information. In this case, we're talking about heart rate information getting out of control. And to me, that's much less damaging, I would argue, than your credit card information. So I think we have to get a little bit used to what kinds of information, could help you, the cost benefits out there. If there is a breach in your heart rate data, how much is that really going to hurt you? I predict not so much. If it does hurt you, well, we better have some laws that protect you for that sort of thing. You shouldn't get shut off from insurance if your smartwatch tells you that, there's a heart issue going on. I would argue that should help you. You should actually get paid to wear a smartwatch because you'll take better care of your health if you can catch these things early.
Yeah, but that's hoping that everyone does the right thing, right, Mike? I mean, I wish.
Very Pollyannish.
I wish it was like that, but unfortunately, there are some bad actors, that will end up, using this technology in a bad way, and unfortunately hamper any advancement. But I agree with you. The potential is huge.
No, just to pick up on that a bit. I mean, we've had long debates in the UK over privacy, and data is sort of, it's a big question again that's sort of on the table as a result of the pandemic. With sort of some external vendors coming in, collecting sort of data to help the NHS respond. But sort of the care.data debacle of a few years ago, I don't think we've actually quite kicked off a real debate on what sort of levels of data people are willing to provide, I guess, for sort of what I see as sort of a social good, a public good, right? In this case, it is literally whether you are going to affect someone else, and there is a public good element of that and a spillover effect, right? So how do you see these sort of privacy debates developing, or how do you think they should develop is probably the more pertinent question.
Well, I would push back on that slightly, and this is obviously a personal view, that I think that we have seen, certainly in the UK during the whole the pandemic, a massive community response in terms of how we respond to the pandemic, and that goes from clapping from the NHS to mutual aid groups being set up. So I think that people do understand the idea of and feel very strongly about the idea of collective good. But I think what needs to happen is people just ask for transparency, and they need to be engaged early on. And I think that when we get those two things right, we will find that there's much less friction in terms of uptake of wearables and other similar technologies.
Mike, I know you've been working similarly on some, a data platform that is about sort of collecting a sort of very privacy protecting version of this. And Jennifer, similarly, I'd love to hear your sort of views on some of the thornier aspects of the privacy debate here. I know Mike's got a slightly Pollyanna-ish approach to it, but I'd love to hear what's your perspective on that.
Yeah, well, both of us are doing research studies, so our research goes through an internal review board that reviews and approves of everything that we do. When participants join our study, they go through an e-consent where they learn about how we're using the data and how it's being stored. For our research study, people can share as much or as little data as they want, so it's 100% opt-in. And I think that definitely needs to be maintained going forward, that participants and the general public gets to decide kind of what data and how much is shared.
Yeah, I agree. I think you're in charge of your own data. You should have the option of either sharing it or not. My hope is that people will share data, because I do think it does benefit the public good. If you are trying to follow a pandemic the way Jennifer does, I love her population spreading detection methods. I think sharing data is absolutely essential for that. So I do think a lot of good can come out of sharing data. I hope people will do it. I think the general harm from, again, collecting this kind of data, using it, I think the risks are usually low. And in many cases, you kind of want to know. Imagine you have a smartwatch and it's telling you something's a little off, and it turns out to be AFib, so a heart irregularity. To be honest, I think you want to know that before you have heart failure. So I think these things could be very, very powerful. What you don't want to do is discriminate people. You don't want to cut them off if AFib gets detected. And that's where laws come in. That's where you set up and say, look, if you have one of these conditions, we're going to protect you. My own view is that providers like NHS should actually pay people to wear a smartwatch. First of all, they'll be more active, probably take more steps, at least for the first few months. And then they could probably tell when they're getting ill much earlier than if they're not wearing these things. So I actually think you can do much more preventative health, if you will, preventative medicine, and keep people healthy. And I think that should be the good incentive for providers to actually get these devices and other things out there. First, though, we do have to demonstrate utility. I totally agree with you, Naeem and Jennifer. We have to show they are useful. And I think that's happening right now.
And to add to that is understanding, increasing understanding will increase compliance. So I think that although you make a very reasonable suggestion that the NHS invest in wearable technology, we also know that there are very many treatments out there that we know are very good for people, but people just don't engage with. So again, it comes back to just increasing understanding, and I think that will lead to better compliance and success if we go down that route.
Well, you're hitting some of the behavioral things. Oh, go ahead, Jennifer.
Oh, I was just going to say the exact same thing. We definitely need to better understand engagement and factors that influence long-term wear of these devices, because we do know that many people get them and then just lose them or stop wearing them. So figuring out how to engage them and provide something really useful back to them, better understanding their health and what these changes in their data actually mean, is definitely going to be important going forward.
Yeah, and on those same themes, the best way to incentivize people is to pay them. They get a break in their insurance, or their, maybe a little bonus in their paycheck if they actually do use the devices, and then say walk 10,000 steps a day or whatever that number is going to be. But the point is, I think financial incentives are usually the best motivator.
Spoken like an economist, Mike. Yeah. Yeah, I mean, so what does the health service provide? A private insurer in the UK called Vitality runs a sort of a model which, you essentially provide an Apple Watch for free if you meet certain metrics of sort of fitness. And as I sort of alluded to earlier, Singaporean government has essentially done the same thing now. I think there's a sort of, I imagine there's a bit of a worry sometimes if people feel like they're then being surveilled by the state. And the broader sort of outcomes, I think, are very positive, and I agree with you, Mike, on that. But I wonder how as much as you can sort of incentivize and sort of tell people the benefits, I wonder if you can ever sort of come over that hump of just sort of a slightly more worry that the state then has information about you that is then sort of used to surveil you for other factors, whether that be like welfare or some other elements. And I wonder how you overcome that. I mean, Naeem, you probably are the closest to this.
I would say that one of the things that has come out from the pandemic has been the acceleration of digital transformation, particularly that I've seen it within health services. And so certain things that maybe there was a reluctance to in pre-pandemic have come in, so there may have been some reluctance in some quarters around video consultations, etc. But that now has become, people are very comfortable with that. That's not to say we lose, the face-to-face element to medicine, but so I think people need to feel comfortable and need to see the arguments and benefits for it. And again, a key to all of it is transparency, and once that's achieved, I think that I can't see a limitation in terms of engagement with a device if those things are all ticked.
Yeah, well, I agree, but just to use a different analogy, the world's becoming like Amazon, where people, they want to order the things from home. And that was true even before the pandemic. It was always strange. People would go to a doctor when they're healthy to get a checkup for a lot of things that are fairly routine that could be done at home. And so thanks to the pandemic, not that we wanted a pandemic, but thanks to the pandemic, telehealth is now getting accepted, and it's being used, several orders of magnitude more than it used to be used. And now it's going to be here to stay, and it's only going to accelerate. And so I think we do need to get used to embracing new technologies. The world was heading this way and was just moving very slowly, I think because medical system is pretty conservative. They always said, well, you need the human element in order for us to really contact patients. But that's really hard to do, getting back to this issue about what about poor areas of the world that are hard to reach. I mean, there are people who live very, very remotely, even in the US, that are very, very hard to reach. Their doctor is an hour away. And so to me, these wearables are extremely effective, at least at getting some level of health monitoring on these folks that can actually be, covered and then relayed to their physician, who can actually then follow what's going on. So again, I think they can embrace things in ways that just weren't possible before.
So I think this is a really interesting point, and I know we're sort of getting towards the end of our session. So it's probably a good place to get sort of the final kind of thoughts on this, which is, I think, obviously it's just a deep tragedy on many, many levels. But, if there is one silver lining, is that, we have seen the acceleration of sort of technology within healthcare delivery, and hopefully in which kind of lends to itself to a longer term settlement. And I know, Mike, previously you said that medicine is essentially 100 years behind dentistry at the moment. But maybe sort of as a good way to sort of round this all up, it would be interesting to hear sort of all of your perspectives of sort of your vision for where you hope health will go in the sort of the coming period, and sort of the long term role, I guess, wearables fit within that and within the sort of preventative healthcare system. Maybe Jennifer, would you like to kick things off?
I think they'll change how we compare each person. So right now, if you go to your healthcare provider, you're compared to a population average. So if my resting heart rate's between 60 and 100, I'm considered normal. But I think wearables will really change the ability to identify what's normal for each individual, which will then enable us to better understand changes that may indicate something's impacting your health, such as viral illness. And I think at the population level, again, this will bring surveillance into the digital age. I think it will speed up our ability to track infections and to zoom in and be able to identify exactly where these outbreaks are occurring. So hopefully next time we can stop the spread before it turns into a pandemic.
Absolutely. Mike, has the provocation on dentistry. So,
well, here's another way to look at it. Every car has sensors on it. Has gas gauges, has accelerometers for measuring speed, has all kinds of sensors for your brakes and transmission and all sorts of things. And we have a dashboard that reads out the products of that, tells you when your car is healthy, so to speak. And yet humans have, for the most part, nothing. Most people do not wear a device, but they easily could, and that could become the equivalent of your car sensors. And the dashboard is your iPhone that reads out your health state and many different physiological parameters. So I really think that we can use this technology to be following people's health while they're healthy, catch disease at its earliest time, and be most effective as a consequence.
Naeem?
So I think that wearables and the novel technologies have an opportunity. That there's a possibility that they could become part of the problem and exacerbate inequalities, but also there is a really exciting potential for them to be an important part of the solution in terms of reducing inequality. I think the points that Mike made are really pertinent in terms of how we can make it accessible to all. I just think that we need just to tread slightly carefully in ensuring that happens and that no one's left behind.
Yeah, I mean, it's an important point, and I think, I still, from just sort of summarize, I think my perspective on this is that we still sort of use quite, well, I mean, 19th century technology sometimes within sort of the 21st century problems, and I think sort of Jennifer's point, particularly on like thermometers and sort of and then understanding your baselines and deviations from it, which Mike has also discovered, is just a really important thing to begin to understand and gain control over. I think your own sort of health and understanding, whilst then working with the sort of the broader clinical sort of network. It's not sort of taking everything under one's control, but it's actually, syncing up and actually getting a better sort of, I guess, feedback mechanism within the broader system of healthcare delivery, and also to this broader sense of actually, being able to stop, pandemics and viral illnesses. I could, from my perspective, I imagine we'll think very differently about going into work, even if we have the flu in the future. If we had a wearable that's telling us something's a little bit wrong, we kind of feel a bit sniffly. We'll think, well, maybe we don't sort of go and sort of infect 10 other people. And I think it probably has changed our thoughts, and there'll be a long overhang of this pandemic, and some of it positive, some of it negative. But thank you all very much for coming in. Very, very interesting. Any last comments any of you want to finish up on? Otherwise, I will hand over to Dr. Jack, I believe, who's going to be wrapping up today's session today.
Yeah, thank you very much, Benedict, Jennifer, Naeem, and Michael, not least for waking up at 5 a.m. from LA to join us. Thank you for a great session. So some of our panelists on this session we've just had will head over, I believe, to the Q&A, which starts at 2 p.m. And if you've got a gold pass, I am informed that you just need to click on the link to join them to ask all of your questions. And apparently, if you don't have a gold pass, you can indeed sign up for a free month's trial right now on the cogex.co website. I'd love now to wrap up by re-inviting Laura Robinson, Health and Life Sciences Lead for Microsoft UK, back to join me. Laura, welcome back. Please tell me what your highlights were of today. Any particular things that stood out and new things you hadn't learned before?
Yeah, it was such a great day. I was really impressed with the breadth of the insight and the richness of the dialogue. I'd say the one thing that struck me is with all the progress we've made through the pandemic, we still have a lot to do. I really enjoyed the discussion with Eric Topol and his focus on the use of AI. And he used this concept called deep medicine, whereby at the end of the day, the most important outcome is the relationship between the clinician and the patient. And that should be supported with machines in the background doing the work that they need to do. I thought that was really quite insightful. Obviously your whole role is to look into fast tracking the future of healthcare, whether it's AI or wearables and so on and so forth. Where do you think the biggest next steps need to come from, and actually, really concretely, aside from the tech, so what will we see the biggest reduction in? Is it going to be a something in cancer? Is it going to be a prevention of a something else? Where do you feel it's going to be? Well, I think it has to come from a myriad of places. And I know that's not the simple answer you're probably looking for, but I think, going back to the discussions and the speakers we heard from today, it's going to take a combined effort. And we need all of these companies, all of these people, all of these clinicians, all of these factions focused on advancing technology and healthcare for a better outcome. I think there are, I use the analogy, there are 1,000 problems within not just the UK healthcare system, but globally. So there's no shortage of needs. I think we have to be wise and pick those that have the best potential to create the best patient outcomes. And I think what we witnessed today was just evidence of that. Whether it is, to your point, donning new wearables, looking at the power of AI, looking at the power of data, I think all of those are important. And I'm pleased to see advancements coming across the board. And yet more work to be done.
Sure thing. Just finally wrapping back to our first speaker today, Christina, on the importance of compassion and empathy and so on. What's Microsoft's stance on this sort of very underserved area of bringing compassion back, as opposed to data and deep understanding from neural networks? How can we help the deepest part of our compassionate neural network in here to work better?
I think it's actually, and I'm going to reference again Eric Topol's session where he said it's almost like going back to the future. Having that empathy, having that compassionate view on the patient and the needs of the patient isn't new. We seem to have lost it, perhaps. And if you think about the movie Back to the Future, they got the best of both worlds, which is harnessing the power of technology so that in the background, the tech can improve and increase the speed by which, the accuracy by which, the efforts by which we come to the market. But at the end of the day, we want to make sure that the technology is in the background to enable the clinicians and the patients to be at the forefront, because that is the most important element. I can't wait for you to do all of the background horrible stuff that I don't want to do in terms of processing results and goodness knows what else. And I'd love you to give me a heck of a lot more time to actually have quality conversations with my patients. So if ever you need a guinea pig to try more of this stuff on, then I'd be very grateful. But thank you very, very much indeed, and of course for all the efforts that Microsoft remains committed to in the UK and beyond.
And thank you for the opportunity. Thank you.
Oh, well, of course. So thank you very much to our audience for joining us. I hope you found the sessions thought-provoking and learned something new. As ever, I have as well. Despite me being on a lot of these things, I was really taken aback by the breadth and the thoughtfulness of especially this element of combining compassion with technology and making that an important thread throughout. Next week, COG Extras will be turning the spotlight to creative industries, and if you've missed any of the sessions or any of our talks, they're all going to be available on cogx.co for you to catch up on, and so do check them out and spread the word. Thank you very much for joining us, and look forward to seeing you next time.
Want access to more CogX videos? Subscribe now for free at cogx.co.